Who decides when a patient lacks capacity? Imagine being unable to make your own health decisions. Who then steps in to decide what's best for you? That's what we're exploring today. When someone can't make decisions, a process kicks in to find out who will speak for them. The first step is usually the doctor or healthcare provider caring for the patient. They assess whether the person can understand information about their health, see the consequences of their choices, reason through options, and clearly communicate a decision. This is called a capacity assessment. It's not about whether the patient makes the right choice, but whether they can process information and make a consistent decision. Capacity isn't the same for every decision. Someone might understand their medication options but not grasp complex surgical procedures. The assessment begins with the clinician observing the patient during routine care. If there are signs of confusion, sudden mental changes, or refusal of treatment without understanding, a more formal evaluation is needed. The clinician then asks specific questions to check for key abilities. Understanding relevant information, appreciating their medical situation, reasoning about options, and communicating a clear choice. Sometimes, the clinician uses standardized tools like the MacArthur Competence Assessment tool for treatment. These help give a structured view of the patient's decision-making ability. The clinician documents everything: what questions were asked, how the patient responded, and why they concluded whether the patient has capacity or not. If the patient is found to lack capacity, the clinician then looks for a surrogate decision-maker. This could be a legally authorized representative, like a healthcare proxy, or a family member who knows the patient's wishes. In emergencies, where waiting could cause serious harm or death, healthcare providers may proceed with treatment without formal consent. They do this to protect the patient's health while respecting ethical principles. This process balances respecting a patient's autonomy with protecting vulnerable individuals who cannot make decisions for themselves. It ensures that decisions are made thoughtfully, with the patient's best interests in mind, even when they cannot speak for themselves.